So hello everybody. Let me ask you to speak about sepsis this month. So we've all heard the term sepsis, but what does it basically mean? So sepsis is 100% connected with some type of infection somewhere in the body. Normally, the body is able to contain the infection into around the organ where the infection happened. If somebody gets a UTI, most of the time the infection will be limited to the bladder, and then usually the body will clear it up. But if for some reason the infection spreads outside the organ into the bloodstreams, then what happens is the body will release chemicals from the white cells, which are supposed to fight the infection. So if there is an imbalance between the amount of the chemicals which are released, that leads to sepsis. So sepsis, the definition would be an abnormal response of the body to the chemicals which are released in the bloodstreams to fight the infection. So who gets sepsis? Well, anybody can get sepsis, but there is a certain population of people who are more prone to getting sepsis, and those are the ones, children under the age of 1, because their immune system has not properly developed yet, elderly above the age of 65, because the immunity now starts to wane off, people who have underlying diseases, chronic diseases, which would include diabetes, liver disease, dialysis patients, people who have catheters inserted inside the bodies, tubes, either for IV hydration or central lines or dialysis catheters or whatnot. And other people with devices like pacemakers or pain stimulators or other devices of that kind. So I personally had sepsis myself once from a tooth infection. So I had this little abscess sitting in the tooth, which was dormant in the jaw for many years. And this dentist picked it up, and he decided it was a good idea to clean it out. So once he cleaned it out, the pain wouldn't go away. So after a couple of days, 2-3 days, the pain was severe, and then of course I started getting a fever and became septic. So a young person can get sepsis and actually die from it. Lucky for me, Dr. Boris used to be around. I don't know if any one of you knew Dr. Boris. So I was a little confused. I couldn't figure out what's the right thing to do. So he figured out immediately what was happening to me, and he established an IV. We got some antibiotics from an outpatient surgery center, and he treated me at his house for a few days, and it was all better. Now, most of the patients with sepsis, they need to be in the hospital setting. So let's just have a look at the statistics on the first slide there, and you'll be surprised. Now, there's 5 million people all over the world which die every year from sepsis. I think they had about 1.6 million cases of sepsis in the US. One other common cause of sepsis is pregnancy. So pregnant women, especially if they're trying to have illegal abortions, or they have early abortions where part of the placenta was left inside, that can lead to infection. That's a very common cause of death in undeveloped countries. And then most of the people that are dying there, it's small kids, less than a year. They will usually get meningitis, and that leads to infection all over the body, leading to sepsis, and they usually die. So only 55% of Americans have ever heard of the word sepsis. I don't know what's the significance of that. But here's the important thing. It's the third leading cause of death in the United States. So after the heart disease and after the cancers, it's probably third on the road. The good news with sepsis is if somebody is able to recognize it early enough, like Dr. Boris did, then there is a 100% cure rate. You can be saved. So the time is the most important thing in sepsis. Early administration of antibiotics and early recognition of sepsis is the key. And why is that so important for you guys? Because your population that you take care of in this facility is all at high risk of developing sepsis, just merely based upon the age. Because you have patients who are above 65, lots of them. You have had people who have had long stays in the hospitals. You have people with the devices. You probably even have people with the catheters in place. And of course, most of the patients that you have here, they have multiple comorbidities like liver disease, kidney disease, diabetes, COPD, all those things. So we can get out of this slide, go to the second one, and of course it talks about the time. So when it comes to sepsis, the crucial thing is time. Now there is a little mnemonic they make with that in order for you to remember how to make the diagnosis. The first one is temperature. So the temperature can be either high or it can be low. Sometime in elderly population you will see that the temperature goes low, and that's as significant as fever. So the magic number there is 100.4. So temperature higher than 100.4 is considered significant. The low number, the magic number, is 96.8. So any temperature below 96.8 is considered abnormal and needs further investigation. So T for temperature, I for infection. So if someone has signs of infection, like burning sensation passing urine, new cough with production of phlegm, these are the sources or common sources of infections. I think another common source that you will see in your facility is wounds. So if somebody has wounds in the skin, burns, decubitus, ulcers, that would be another thing. And I think you guys do get a fair amount of osteomyelitis too. I think after they've been, but lucky for you, I think you get them after they have been put on the antibiotics. So that's a source of sepsis too. We get that in the offices in diabetic patients who have foot ulcers or foot wounds. And they don't even realize they get infected and they can lead to sepsis. Outside of the community, we've had cases with fingernail infections who will spread into cellulitis, which is a skin infection, and then go inside and cause sepsis. I think we picked up a spider bite once. A person had a spider bite in his neck, and that led to sepsis. A very interesting case that I had a long time ago was, I think I spoke about this before. This was somebody who got septic, probably my last year's talk on sepsis. This was somebody who got an infection, and the organism that we isolated was something which grows in the dog's mouth. So we said, how did somebody get this organism in his blood? This bug is only found in dog's mouth. So the dog was licking his feet, and he had cracked, he had liver cirrhosis, which made him prone to getting sepsis. And then he had cracked feet, so the dog would lick his feet. So from the saliva of the dog, the bug got into his bloodstreams. That was an interesting case. And the way I figured it out, I was actually driving, and I was listening to these CDs from the medical society. I used to listen to those back in those days. And the guy was talking about that situation, exactly. So then I go to the Waterman Hospital, and I'm looking at this person, I look at his blood cultures, and it is growing the same bug. It was just such a coincidence. Anyway, we can get out of this. No, sorry, didn't do the M. So M is mental decline. So of course, that's the tricky part because you see a lot of patients who have mental status changes. They're not quite with it, or they're a little bit demented. So the mental decline that we're looking for is a new change, not if they're already confused, they came in confused to your facility, that doesn't quite count. But if they came in normal and now they got confused, that's a different story. Now, if they were confused and now they're more sleepy, they can't be aroused, that would be considered a new change. So drowsiness, sleepiness, inability to be aroused, more confusion on top of what they normally are. Combined with a temperature change, that is pretty much a sepsis. And the other thing is, with the E, people who have sepsis, they usually look very, very sick. They are just sick looking. We have a term in medicine called toxic look. So they just look toxic somehow. You can usually, once you've been working with patients over several years, you can usually tell once you see some of those sick people that he just doesn't look right. So let's get out of this. Let's go to folder 2. We can start off with, there's going to be some repetition, and the reason, usually I don't like repeating things, but I've specifically included some things for repetition because I want you to remember these things, and they're worth remembering. So the more I say them, the chances are they'll stick with you. So we can look at the first slide. Now let's get out of that. Sorry. Actually, yeah, that's fine. Sorry, we can look at it. So what happens is the first step in there's a progression of disease which leads to sepsis. And the first step which happens before you get septic is something called SIRS, S-I-R-S. And what it stands for is Systemic Inflammatory Response Syndrome. And the reason they have come up with this term is because they want people to pay attention to it and be able to recognize sepsis before it happens. So that's what you're going to get before you get sepsis. And the systemic inflammatory response, basically what it is saying is that your whole body, there is some type of inflammation going on there. The first thing, of course, is temperature. I think they said 104 degrees or 96.8, so that's a magic number. The heart rate, more than 90. Now, we are talking about sinus heart rate, not people who have atrial fibrillation all the time. They can get a fast heart rate for a different reason. And again, remember, one of these is not enough to justify the diagnosis. So you got to have at least 3 of them present out of the 4 to point to you that patient may be developing sepsis. The respiratory rate, more than 20. Now, we have COPDers who breathe more than 20 all the time, but of course they don't have the fever to go with it. And then if you have access to the lab, and you can get some lab draws, a blood count, a white count of more than 12,000. So you gotta have at least 3 of these in combination to make a diagnosis of SIRS, or Systemic Inflammatory Response Syndrome, which could point to you that a person might be developing sepsis. So can you get out of this? Go to the next one. So if you look at the sources of sepsis, I like this picture because it kind of tells you where can you get the infections from which lead to sepsis. Most commonly would be the lung, 35%. So 35% of cases of sepsis usually will come from lung. Most of the time it'll be some kind of pneumonia. The second most commonest cause, in my experience, is the urinary tract. I think it's probably even more common, when people get older, they seem to get the urinary tract infections a lot more commonly. So that's the other important cause is gut. So something happens in the gut, either the gallbladder ruptures, appendix ruptures, somebody gets a colitis, a bad case of colitis, and it's not treated fast enough. The other one would be ischemic valve. So if somebody was to get an ischemic valve, usually that will lead to organisms, the part of the valve dies, and some of the organisms from the intestine are going to move into the bloodstreams and cause the systemic response. And then of course we got the skin. Skin, decubitus ulcers, cellulitis, that type of stuff. Yep, we can get out of this. So this is a little picture of, can you make it bigger? Of what I just said when I started the speech, that you have bacteria which can get into the bloodstreams, and then the white cells right there will combine with these bacteria. They will try to kill the bacteria, and they will release these chemicals. Now these chemicals, unfortunately, if they are not balanced right, lead to the whole process of sepsis. And what is happening in sepsis is that these chemicals, they will make the blood vessels leaky, and they dilate the blood vessels. Now when the blood vessels get dilated and they become leaky, you will start losing pressure. Because how does the body maintain blood pressure? It maintains the pressure by the beat of the heart and how constricted or how tight are the blood vessels. If the blood vessels are loose, the pressure will drop. And then of course you lose a lot of your fluid from the blood vessels. It goes into the different tissues. So, and then of course it also causes a disturbance in the clotting mechanisms. So normally you're only supposed to get a clot if you get a cut. But in this situation you will start getting clots inside the blood vessels. So getting clots inside the small blood vessels will prevent the blood from going into those organs and damage those organs. And I think the delicate organ which gets damaged initially would be a poor flow to the brain, and that's why people get confusion, that's why people become sleepy. The other one would be the kidneys. So if not enough blood is going to go into kidneys, they stop filtering the poisons from the blood, and of course they stop producing the urine. And that will lead to worsening of the condition. So the problem with sepsis is you start off a process, and then it affects the whole body, and then all organs, they start failing, they start doing their job, and then of course the whole body shuts down. So we can get out of this. Let's look at the second one. No, the next one. No, the other way. Yeah, yep. So let's see if we can enlarge this. So these are the steps in the in sepsis. Unfortunately, poor quality picture, but let me explain it. So first of all, you have that SIRS, which was the systemic inflammatory response syndrome. So if you combine the SIRS, whatever I said there, and combine it with some kind of confirmed infection or confirmed or suspected infection, you have your diagnosis for sepsis. And this is where you want to pick up people. If you can pick them up at this particular stage and start them on IV fluids and antibiotics, usually you'll be able to reverse the whole process. If you can't pick it up there, it will go into something called severe sepsis. In the severe sepsis, the only difference is that the blood pressure starts dropping. So the systolic blood pressure, the top number, will start dropping to below 90. And that's where you have severe sepsis. So you have SIRS, a suspected or confirmed source of infection, and now the blood pressure has dropped down to 90. You can't keep it above 90 without giving them fluids. That means you have severe sepsis. Finally, the worst nightmare, the septic shock. So in shock, the difference is, now you have the same situation, except the blood pressure is down into the 60s, and you're giving them vasopressors. Vasopressors are drugs which will try to constrict the blood vessels to bring the pressure up. So now you're using medications, IV medications, to maintain somebody's blood pressure and it's still not coming up, so that's a situation of severe septic shock. Most of these people are in ICU, they're usually intubated, a lot of stuff going on. And I think the mortality would be about 50–60%. So half of them will usually, once you reach the stage of septic shock, based upon your age, there is a 50–50 chance you'll make it. We can get out of this. We'll do the next one. The signs of sepsis. So it looks like a good picture. You're not going to see all these signs, but here's what you're going to see. First of all, the fever, or shivering, or chills. So second one, rapid breathing. So as I said, the respiratory rate of more than about 20–22. Extreme pain and discomfort usually happens in younger population. Elderly population most of the time will not show signs of severe pain. Of course, if they have bowel ischemia or gallbladder problem or appendicitis, they will complain about severe pain in the abdomen. Pale or mottled skin, we will see that in a hospital setting, but you have to be seeing a person every day in order to notice that. Otherwise, you will most likely miss it. Disoriented and confusion and difficulty waking up, I already spoke about that, that's an important sign. And then finally, the elevated heart rate, most of the time above 90, so they have sinus tachycardia. You can get out of this. Yep, let's have a look at something useful. So you have a local infection caused by bacteria. Sepsis can happen, by the way, from viruses. It can happen from bacteria, and it can happen from fungus. The commonest cause would be the bacteria. The most lethal one usually is fungus. When somebody gets fungal sepsis, it usually means they have very, very poor immune system. So you get local infection, supposedly in the lung, travels into the bloodstream, white cells start the response to fight off this infection, and basically, due to these excessive chemicals, you start a whole reaction inside your body, leading to end organ damage if you leave it untreated. You can get out of this. So, go to folder 3. Let's look at the second one first. So these are some general risk factors for getting sepsis. Somebody who has been on mechanical ventilation, IV lines and catheters, Foley catheters, that would be important for you to keep an eye on. Chronic ulcers, wounds. If somebody recently had surgery, especially bladder or prostate, those type of surgeries, or abdominal surgeries. Any kind of severe diseases or chronic diseases, which includes chronic cancers, HIV, liver disease, kidney disease, diabetes, bad COPD. Immune suppressed status. So the immunosuppressed status usually you will get from chemo. If somebody has had chemo lately, their immune system is quite compromised. That would be the commonest thing. Anybody who's been in ICU for a long time, usually at a high risk for getting sepsis. Prolonged hospitalization just by itself, because a lot of the stuff is happening to them on the top. Postpartum complications, as I explained, illegitimate or illegal abortions usually would be on top of the list. Any type of invasive procedure, this is your favorite, age of 65. And of course, people who drink too much alcohol, alcoholics, and IV drug users. IV drug users because they're just injecting stuff into their bloodstreams, which could be infected, contaminated, all that. It's not clean. So we can get out of this. And the last slide there for the treatment. So now the treatment, from your perspective, the most important treatment is recognizing it. If you recognize somebody and you figure out they're septic, you've done a great job, because then they can be treated and the whole mess can be avoided. So your job is to pick up cases of sepsis if you believe somebody may have it. And of course, you don't need to look at all this, but there are three major treatments for sepsis. One would be, as soon as you recognize it, antibiotic treatment, which of course the physician has to decide which one he wants to give. Most of the time they will give broad spectrum antibiotics to begin with, and then later on they will tailor it to the specific need. The second treatment would be fluids. As I said, the blood vessels have started dilating, they become leaky, you're losing some of your fluid into the tissues. So if you replace enough fluids, there is a good chance you'll be able to maintain the pressure and keep the body functioning normally or better. And then of course the third one is some type of drugs or pressors, which probably would be happening in the hospital by that time. And then there's some more stuff, but not something that you need to know. Thank you. Any questions?